Hi, I'm Dr. James White. I know that you've already undergone ultrasound evaluation for your varicose veins. I'd like to take a moment to show you why people have varicose veins, the treatment options that we have available, and also the normal anatomy of veins in the leg. Here's the left side. This is the groin. This is the knee. Everyone has a single large vein that runs down next to the bone. It splits into two veins in the calf. This is called the deep system. When people get blood clots in the deep vein, those are clots that are significant that could go to the heart and lung. You can see that these deep veins are very large. They're deep in the leg next to the bone. From the deep system, there are other veins that go closer to the surface. The whole job for the veins is to carry blood from the skin surface toward the center and then back to the heart. There are superficial veins, so these are the deep veins. Now we're going to show the superficial veins. There are hundreds, if not thousands, of just short veins with tiny branches that go directly into the deep system, all up and down the leg. There are two medium-sized veins, one that runs on the inside of the leg, along the inseam, behind the knee, to the calf, and then to the ankle. This is the vein that traditional stripping surgery, we remove that. You've heard of people that have had strippings. This is also the vein that can be taken out and used for heart bypass surgery. On the back side of the leg, there's a smaller cousin that does the same thing. In between the deep and the superficial, there are penetrating or perforating veins. They go through the muscle and they attach. This is the skin. Now, the way the veins are designed, God made us so that blood has to flow back to the heart, but it has to overcome gravity that's pulling us down. God gave us one-way valves. They're little flaps of tissue inside of the veins. They allow blood to go through back to the heart, but as gravity tries to pull down, they close. They're one way. We have lots of valves at these junctions here. That way, blood that the arteries have brought to the surface is channeled into veins. The flow is from the skin surface toward the center of the leg and then up in the deep system toward the heart. If your valves do not work when the pressure is great, so that if you stand up, blood wants to flow out this way, and that's called reflux. These veins are not designed to carry large amounts of pressure or large volumes. The veins near the surface are very thin-walled. They're not under a lot of pressure. If you create pressure, they bulge. Same thing happens in the leg. If your valves don't work, the blood flow backs up. You have reflux. It causes these veins to bulge so they get larger. Any branches that come off that go to the skin surface are under pressure, and that's what causes varicose veins at the skin surface. You may hear many patients that say, well, I had my veins injected, they went away, and they came right back. The reason is you're injecting here at the surface, clotting those tiny veins off, but the root of the problem is usually here where the valves aren't working. Until you take care of the deeper veins and the root of the problem, you will never get rid of the surface varicose veins. Before 2002, the only options that people had for varicose veins were compression stockings or support hose and a vein stripping. A vein stripping is surgery where you have multiple incisions all the way down, and we actually strip this vein out, sometimes the vein on the back side. These perforating veins, we would tie those off. But in order to do a stripping and tie off or ligation, patients would have 30 or 40 small incisions. They had to be placed under general anesthesia. In 2002, a new procedure came out. It's called EVLT, or endovenous laser therapy. Most people have seen the Christmas ornaments that have fiber optics. They have the long fibers and the light comes out at the very tip. We use these same type of fibers, but instead of light energy, laser energy is coming out the tip. The EVLT, we numb a place at the skin surface and we start a small IV directly into the vein using ultrasound guidance. With a laser fiber, that same fiber optics, we run a laser fiber, float it up to this point right here. Most people say that it feels like a crawling sensation. It doesn't cause pain, but just an odd sensation. We then numb this vein up, 4 or 5 little injections to completely numb the vein. Then using high intense laser energy, we seal this vein closed. Once that vein is closed and the pressure is off of this system, then we come back to the surface and we inject a special type of foam medication called sclerovein between the laser treatment and the sclerovein. That's how we get good results as far as closure of varicose veins. Laser therapy cannot be completed below the mid-calf. The laser causes intense heat. There are very small nerves that come very close to the veins here. If you heat this vein, you will heat the nerves and cause nerve damage. But once you've taken the major pressure off, once you've closed these varicose veins, we can also use the foam, a chemical foam for varicose veins below this surface. Some patients have problems with varicose veins not only in this greater saphenous vein, but also on the back side of the leg in the lesser saphenous. Many patients will say, well, what's going to happen to the blood if you take away my vein? This vein, the greater saphenous and the lesser saphenous, can both be completely removed without any consequence if the deep vein is still intact and working well. Remember, I told you at the beginning there are hundreds, if not thousands, of small veins, short, that drain directly into the deep, and they take over the workload from these diseased veins that have been removed. Let's talk just a minute about risk. There are 3 minor risks: bleeding, infection, and blister formation. Bleeding because we puncture the skin, infection because we puncture the skin, blister mainly associated with the foam, Some patients get little water blisters because the foam is irritating. That's the way that it causes a chemical burn to the vein. It's also irritating to the skin. This happens in about 2% of patients. 1% of patients can actually get black scabs that can scar from the foam. It is a minor risk, but it is a risk. Deep vein clot. These are considered minor risk, bleeding, infection, and blister. Deep vein clot is considered a major risk. It is a major risk because of the potential, not because it happens very often. Deep vein clot only happens about 1% of patients. When we laser this vein closed, the blood flow through this area is no longer present. The body will naturally clot this vein all the way up to there. Some people have abnormal clotting properties. Their body doesn't know when to stop. They will continue to clot until they get clot out here into the deep system. Now, people that have EVLT and people that have foam, they will be sore at the skin surface where we've closed this vein. People that have deep clot, they have a tremendous ache at the groin or behind the knee. No matter what position they're in, their leg aches. If after having the laser procedure you notice that you have this tremendous pain, you need to be on the phone calling our office. Because what happens is we would immediately do an ultrasound to see if there is evidence of deep clot. People that have deep clot, they need to be treated with Coumadin, a blood thinner, for 3 to 6 months. At this point in time, we have done 650 laser procedures and well over 750 foam procedures. We have had 3 patients to develop deep vein clot. So it is a very low risk. I tell patients about deep vein clot because I want them to, number one, understand the signs associated with it so they'll come back early to be on treatment. And number two, respect this potential problem as much as I do. Well, that's the overview. Y'all just sit back and relax. I'll be with you in just a moment to discuss your case specifically. Our staff has provided you with brochures. Please feel free to look through those, and I'll be with you in just a moment.